Dementia and thought disorders. We're talking about delirium and dementia. We have changes in mentation and the cognitive impairment, and it can occur any time in life. It doesn't matter how old you are. Cognitive functions will change with age. We'll see short-term memory and learning ability deficits. Our older adults are going to be at greatest risk for cognitive impairment, but this is not a normal consequence of aging, and it should not be considered untreatable. It is important to realize that depression and other medical disorders can manifest as a mental dysfunction. So question, true or false? Mentation or changes only occur in advanced age. We know that that is false. So with delirium, we see a sudden transient state of confusion. In other words, it comes on abruptly. These clients have difficulty processing information. They can be very disoriented, impaired judgment, poor intellectual capacity. They can be very suspicious and frightened, have inappropriate behavior. Causes can include a high fever, head trauma, brain tumor, drug intoxication or withdrawal, metabolic disorders, inflammatory disorders of the CNS, or it can be the presenting symptom of infections or response to some medication such as anesthesia in the older adult. So treatment will be aimed at the underlying medical condition. Dementia more commonly affects the older adult, but it can affect the middle-aged adult also. It is a gradual, irreversible decline in memory and other mental functions and can affect the individual's daily life. Disorders characterized by dementia include Alzheimer's, cerebrovascular disorders, and Parkinson's disease. The main dementia that we talk about is going to be Alzheimer's. It's the most common cause of dementia, and it is a progressive deteriorating brain disorder. There are two types. We can have early onset and late onset, which is the more common. With the increased risk of early onset, we have a first-degree relative that does have Alzheimer's disease because of inherited genetic abnormalities. Causes of the late onset dementia can be a combination of lifestyle, genetic, and environmental factors. With Alzheimer's, we see 4 pathologic changes in the brain. We have a decreased cortex size and deficient acetylcholine. These explain the cognitive deficits and altered emotions. We also see neuritic plaques and neurofibrillary tangles that are related to the disease manifestation severity. So there's 3 distinct stages. We see preclinical, where changes are made in the brain, but no symptoms are seen. There may be some mild cognitive impairment where the client is able to still live independently, but they're beginning to show some memory deficits. Alzheimer's dementia may have significant cognitive decline. Not may, but will have. The classic symptom of Alzheimer's is going to be memory loss. It does have that insidious onset. We have impaired long-term memory, an inability to make appropriate judgments, problem-solving ability will decline, behavior disturbances, personality changes, and depression. These clients may have been very mild-mannered, through their life, but now with Alzheimer's, they become violent, or vice versa. They may have been very aggressive, and now they're very mild-mannered. With advanced Alzheimer's, we begin to see deterioration in the memory, cognition, awareness, and their ability to take care of themselves. They may wander, may have periodic violent behavior. We may see aphasia, alexia, agraphia, acalculate, agnosia, ataxia, tremors, and apraxia. We diagnose with an electroencephalography, CT scan, a PET scan, an MRI. A new diagnostic is what we call NIMOX AD7C. Medically, there's no cure, so we're going to treat them supportively. Drug therapy can slow the progression or improve the symptoms for a period of time in some clients. We can also administer folic acid supplements, antidepressants, and tranquilizers. But some of the medications we can administer other than that to treat symptoms would be cholinesterase inhibitors that are indicated for Alzheimer's disease to enhance and maintain the memory in mild to moderate disease. It is contraindicated with drug allergy, gastrointestinal or genitourinary tract obstructions, bradycardia, cardiac impulse conduction defects, hyperthyroidism, epilepsy, hypotension, and COPD. Adverse effects of these cholinesterase inhibitors would be overstimulation of the peripheral nervous system, syncope, and hypotension. These drugs include donazepam, galantamine, and rivastigmine. We can also administer NMDA receptor antagonists, which once again are indicated for Alzheimer's. Contraindication would be a drug allergy. It does interact with several medications, so important to look at those interactions. Adverse reactions include CVA, suicidal ideation, congestive heart failure, tachycardia, hypoglycemia, liver and renal failure. This main drug is going to be Namenda. So as nurses, it's important to maintain the client's independence in their home environment for as long as possible, and then refer to an extended care facility if or when it's appropriate. It's important to continue continuity in the people, places, routines, etc. in dealing with these clients. Minimize choices. Never argue with them or agitate them. These clients may still remember how to do simple tasks such as shaving or folding laundry. They may remember their favorite foods, etc. Important to provide emotional support to caregivers. Make sure that we're assessing for client safety and assessing caregiver burden. It can be so difficult to take care of someone with Alzheimer's. These clients don't have normal sleeping hours, and they can be awake at all hours of the day or night. Nutritional support includes finger foods and nutritious fluids. Assistance may be required in feeding, and in later stages, feeding tubes may be required. So true or false? Alzheimer's disease presents in two forms. This is true. Remember, we have early onset and late onset. So true or false? The goal of Alzheimer's disease treatment is to place the client in an extended care facility as soon as possible to maintain his or her safety. This is false. We want to keep them in familiar surroundings as long as possible.